Good afternoon, everyone. We will get started in just a few minutes. We will let everyone have a chance to sign on.
Good afternoon, everyone. I'm Laurel Aragona from Pseudocol Labs and one of the co-chairs of the AFTO Body Art Committee. We would like to thank you for joining us for the AFTO Professional Development Series. We are here today with Kathy Monty and how OSHA thinks of the body art industry. Kathy has been involved in the body art industry for 44 years and is the owner of Absolute Tattoo, Piercing, and Permanent Cosmetics for over 20 years. Absolute is one of the most well-known shops in the San Diego, California area. Absolute was established in 1998 by Kathy when it was not heard of for a woman to have her own shop. Kathy continues to lead and strive to make the body art industry safe while not infringing on the creativity of an artist. Kathy also owns and operates KathyMonty.com, a business that provides approved training classes to meet the Bloodborne pathogen requirements. The classes are online or can be held at a remote location. Kathy is also poised to launch the classes in China. Kathy is an OSHA authorized outreach industry specific trainer, serves on the California State Steering Committee for AB 300, the California Safe Body Art Act of 2011, and works with the National Environmental Health Association, AFTO, and the Body Art Education Alliance. As a committee member, she provides training and helps unite the body art industry with regulatory agencies in a common goal of safe body art. Kathy became a body art industry representative to the San Diego County Department of Environmental Health in 1997 and has participated in several of the county's industry outreach activities. She continues to provide technical expertise as a member of the department's Body Art Ordinance Committee. Kathy's expertise in the industry has led her to become an expert witness in court proceedings regarding the body art industry. Kathy is a founding member of the California Alliance for the Promotion of Safe Body Art and a member of the National Tattoo Association. We will be taking questions at the end of the presentation, so please feel free to hold on to your questions or type them in the questions box during the presentation, and we will read them out at the end. Or you can raise your hand at the end of the presentation and you can ask Kathy the questions directly. Now I will turn it over to Kathy.
Thank you, Laurel and Amy. Hello, everybody. Thank you for having me. I've spent many years, she's right, working with lawmakers and regulators to help form guidelines and regulations for the body art industry, the industry that I love so much. I became an OSHA authorized outreach industry specific trainer so I could educate my industry about our bloodborne pathogen risks and talk with regulators about the uniqueness of the body art industry. OSHA is a federal agency responsible for enforcing the provisions of Occupational Safety and Health, OSH Act, which aims to ensure that employers provide a safe working environment for their workers. We will take this time to talk about how OSHA applies those regulations to the body art industry, which includes tattooing, piercing, branding, suspension, and permanent cosmetics, which includes microblading. Here are some OSHA definitions that pertain to our industry. Contaminated, the presence or reasonably anticipated presence of blood or other potentially infectious materials, OPIM, on an item or surface. We have to be on our toes at all times to recognize or anticipate when we might be exposed to contaminated sources, like when a person comes into the shop and just drops their dirty jewelry down onto the countertop. Or engineering controls that shall eliminate or minimize exposure to the workers by placing a barrier between workers and the hazards. Examples would be our hand washing stations or using sharps containers. Hand washing facilities provide an adequate supply of water, soap, and single-use towels. Handless dispensers or pull-down paper towels are great ideas too. Other potentially infectious materials, OPIM, body fluids, that is visibly contaminated with blood, like maybe a tabletop or countertop, lamp, or bottom of the chair. Personal protective equipment, PPE, specialized clothing or equipment worn by the worker to protect against a hazard. Gloves, aprons, masks, glasses, sleeve guards. The proper use of PPE should be a part of the in-house training. Regulated waste, contaminated items that could release blood or OPIM. The body art facility shall have a predetermined, approved, and/or regulated biohazard waste transporter available when they are ready for sharps containers pick up or mail away. Every state seems to call them something different. Sharps containers are closable, puncture resistant, leak proof, labeled, properly discarded. These containers shall be within 1 step of each procedure area and disposed of with your local regulations. Sterile, the use of physical or chemical procedures to destroy all microbiome life. Totally clean. Work practice controls, standard operating procedures are a written set of instructions to ensure consistency that reduce the likelihood of an exposure in the body art facility. OSHA uses the term work practices, but FDA says standard operating procedures. So we'll talk about both. So what is a body art? Body art is a form of body modification. Tattooing is implementing pigment under the skin. However, it is FDA and not OSHA that can request a recall on defective products we use, and they deal with complaints about ink manufacturing. Piercing is puncturing or cutting to alter the body and/or skin profile and appearance with a piece of jewelry. Permanent cosmetics, including cosmetic tattooing, dermapigmentation, micropigmentation, and microblading, these are all terms to describe a tattoo process. Microbladers are having limited training on many things. However, safety practices are definitely one of them. We see them trying to take the handle off their needle blade tools instead of putting the entire device into the sharps container. This practice can cause them an exposure. They don't really even know that they're tattooing or even need to be licensed with the local health departments. Branding, the process by which a mark is burned into the skin intended to make a permanent scar. Scarification, scratching, etching, burning, branding, or superficially cutting a design, picture, or words into the skin. So what is the Occupational Safety and Health Administration, OSHA? The division of the Department of Labor that sets and enforces occupational health and safety rules. to ensure safe and healthful working conditions for workers by setting and enforcing standards and by providing training, outreach, education, and assistance. OSHA thinks of us as an employer-employee relationship, which means the owner needs to protect their workers from a hazard, like supplying gloves and placing sharps containers next to their procedure area. And how about a hand washing station? Workers' rights, meaning the employer will provide all PPE and engineering controls to have minimized the hazard and train the workers on how they all work safely. However, the workers need to know how to use these items properly and prove it after training. When workers keep themselves safe, you can know they keep their customers safe too. And they're celebrating 50 years of Occupational Safety and Health Act of 1970. What is the bloodborne pathogen standard? OSHA's bloodborne pathogen standard 29 CFR 1910-1030 as amended pursuant to the 2000 Needle Stick Safety and Prevention Act is a regulation that prescribes safeguards to protect workers against health hazards related to bloodborne pathogens. It has provisions for exposure control plans, engineering and work practice controls, hepatitis B vaccines, hazardous communication, training, and record keeping. The standard imposes requirements on employers of workers who may be exposed to blood and other potentially infectious materials, such as certain tissues and body fluids. Pathogenic microorganisms that are present in human blood and can cause disease in humans, like hepatitis B, hepatitis C, HIV, and AIDS. This is why we have universal precautions. It is an approach to infection control in which all human blood and certain human body fluids are treated as if they are known to be infectious. And standard precautions adds additional infection prevention elements to universal precautions in order to protect workers not only from pathogens in human blood and certain other body fluids, but also pathogens presented in body fluids to which universal precautions do not apply. Standard precautions include hand hygiene, the use of certain types of PPE based on anticipated exposure, like gloves, masks, aprons, sleeve guards, and glasses. How can we comply with these bloodborne pathogen regulations? Have an exposure control and infection prevention plan, an ESEP. It helps make safety policies and procedures easy to understand and to follow in the body art industry. Engineering and work practice controls shall be used to eliminate or minimize workers' exposure, like a fully stocked hand washing station with soap and disposable paper towels. How about contaminated needles shall not be bent, recapped, or removed? This again is an issue in the microblading industry as they want to take the handle off the needle tool and can cause a possible exposure to themselves. This is all lack of education. Immediately place potentially contaminated needles in an approved sharps container that is within one step of the procedure area when finished. Never lay a potentially contaminated needle down onto any surface. When you keep handling sharps, there is an increased opportunity to expose yourself to an exposure. Approved, registered, biomedical, waste haulers or transporters, sharps pickup or mail away plan. There are many names associated with this area. It can be confusing to know what your local jurisdiction requires. Always check with your local jurisdiction for their specific requirements and have a sharps pickup or mail away plan. Eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses are prohibited in work areas where there is a reasonably likelihood of occupational exposure. Food and drink shall not be consumed in the procedure area. That is reserved for the waiting room or break room, maybe just a bottle of water with a lid on it. PPE, personal protective equipment, is only effective if it does not permit blood or OPIM to pass through it. Exposure determination is scheduled methods of implementation and is the methods of compliance, vaccinations, and post-exposure evaluation, communication of hazards to workers, and record keeping, provisions for the initial reporting and evaluation of exposure incidents. This is all part of the Exposure Control and Infection Prevention Plan, ESA, that is available to all workers at the body art facility anytime they want to look at it. So here are some classifications for jobs. So who has a possible for contacting an exposure in the body art industry? Everyone. All workers in the body art facility shall be classified as having potential exposure to other potentially infectious materials, no matter their job function, like the practitioner, office worker, accountant, and the housekeeping staff. Exposure control and infection prevention plan. In my ESIP that I put together for the body art industry, we include a lot more. Not only do we have an exposure determination and scheduled method of implementation, we have work practices or SOPs on a fire plan, record keeping for personnel and the facility, hepatitis B vaccination documents, training plans and how to conduct a training in the facility, PPE, hand washing, gloves, sharps containers, hazardous waste. We also have disposable sterile equipment supply log. This is to help keep you on track with lot numbers and expiration dates on all the supplies purchased sterile out of the facility and where they were purchased. Station setup, client preparation, final steps, station teardown, facility cleaning, maintenance, SDS sheets and mil specs, and a complete emergency plan with directions to the hospital or urgent care. Sterilization, Class 5 integrators and spore testing. Also, all the forms or log sheets to be filled out to prove the practitioner has done all of this. We also include, with the purchase of the ESIP, customized informed consent and release forms for our client, and then the artist can complete that circle of sterilization onto the form with the ink used or jewelry used and the expiration and lot numbers from their sterilization supplies. We also customize the aftercare. We are required and include OSHA federal or California Code of Regulation bloodborne pathogen standards. This way, the owners or practitioners can look up a code if need be. Okay. Owners will train on this ESIP and give full access to all workers anytime. Plans should be reviewed and updated at least annually, and most important is to solicit your input from all of the workers. We want to know what they're thinking and how they can help us make this a safe facility. Okay, work practices and SOPs. So FDA says, Say what you do what you say, and document it. Work practices is OSHA's terminology, and standard operating procedures are FDA's terminology, as I understand this. They are both written step-by-step instructions that describe how to perform a routine activity. All workers should physically complete them in the exact same way every time so that each procedure remains consistent. This helps maintain safety and efficiency for each production, operation, or training. Written work practices should never be difficult to read or vaguely worded. Brief, easy to understand, and contain actions and steps that are simple to follow. And again, always solicit input from your workers on the work practices, SOPs, and inform the owner of any safety concerns. It is important that the workers, either new hires or just annual training, are trained on each and everything they do in the facility to maintain safety and consistency. If there is ever an exposure, it is the owner's responsibility to update and train on the new work practices, SOP, to help prevent another exposure. Update at least annually and retrain if any work practices, SOP, or engineering controls have changed. All of these work practices, SOPs, are part of the ESUP and shall be available to the workers anytime. Okay, engineering controls. They protect workers by removing hazardous conditions or by placing a barrier between the worker and the hazard. Well-designed engineering controls can be highly effective in protecting workers and will typically be independent of workers' interactions. They typically do not interfere with workers' productivity or personal comfort and make the work easy to perform rather than more difficult. Engineering controls shall be examined and maintained or replaced on a regular schedule to ensure their effectiveness. Hand washing facilities are readily available to workers and equipped with running water, appropriate hand soap, and disposable paper towels. Again, contaminated needles and other contaminated sharps shall not be bent, recapped, or removed. Sharps shall immediately or as soon as possible be discarded in the sharps container right next to the procedure area after use. Reusable instruments shall be placed in an appropriate container at the procedure site until properly reprocessed without any liquid, unless they have an OSHA-approved lock spill-proofed container. NIOSH, the National Institute for Occupational Safety and Health, who works with OSHA, researchers help prevent occupational disease and injury by conducting engineering control technology evaluations and developing practical solution-oriented control technology interventions. Examples for the body art business include, but are not limited to, a hand washing station, sharps containers, autoclave, and ultrasonics. The schedule and methods of implementation. As we have been talking, this information helps employers, workers, and OSHA evaluate the safety of the workplace, understand industry hazards, and implement workers' protections to reduce and eliminate hazard preventing future workplace injuries and illnesses. This all needs to be documented in your ESUP. Like engineering controls, what kind of engineering controls do you have in the facility? Work practices, everything needs to be written down step by step for every procedure in the body art facility, from sterilization to cleaning the facility. Personal protective equipment, everyone shall be trained on the correct PPE needed for the job they are doing. Management is the process of dealing with or controlling things or people. Someone will need to manage all things that go on in the body art facility, from taking care of the customers to the procedure to cleaning up. And documentation is being responsible for all the paperwork, like completely filling out your log sheets for any task done in the facility. Your ESUP, Exposure Control and Infection Prevention Plan, is designed to provide streamlined implementation procedures, which are OSHA's compliance, and protects the health and safety of clients, facility personnel, and their families. It is a one-stop informational manual that covers the day-to-day facility practices and procedures for an exposure, such as a contaminated needle stick. So what is an exposure? It's a specific eye, mouth, other mucous membrane, non-intact skin, or perinatal contact with blood or OPIM that results from the performance of the worker's duty. In the event of an exposure to blood or OPIM, every effort will be made to the affected person to arrive at the hospital or urgent care facility listed in the post-exposure emergency packet within 30 minutes after the exposure. If necessary, the source individual should accompany the exposed individual. Upon arrival, they will inform the admitting person that they have had an occupational exposure. The post-exposure emergency pack shall be in the ESUP and shall be taken by the exposed person with them to the health care provider. The ESUP shall have a plan on what to do, where to go, along with supporting documents needed to record and evaluate the incident. OSHA's needle stick and prevention plan shall include emergency procedure, post-exposure medical treatment, a consent or a refusal form for HIV, HBV, and HCV infectivity testing, post-exposure incident evaluation, and directions and a map to the medical or urgent care facilities. Protecting people, let's see, we're on employer-employee relationship. So protecting people who work in an environment where they are subject to bloodborne pathogen exposure is critical to both our workers and public health. Workers who are exposed to a bloodborne pathogen may not only have to cope with an illness due to an exposure, but may have to take time off from work, incurring a loss of income to both our workers and our facility. If such an incident occurs, it impacts the staff, their facility, and other staff who may have to fill in, as well as our clients. When we protect ourselves, we are protecting others. So again, it is the employer that is responsible to provide a safe and healthful workplace for their workers. Employers shall establish, implement, and maintain an effective ESUP as required. Work practices or SOPs are established to ensure processes are done the same way each and every time, no matter who performs them. So thank you for having me. I guess this was a little shorter than I anticipated. And if you have any questions, let me know. And please don't ever hesitate to call or text or just email me. Also, thank you to my husband, Bill Wolenchuk, who has all these great ideas and supports me in this mission I'm on. So does anybody have any questions? Hello?
Nobody has typed in any questions,
Aw.
but
Well, they
if you
can
have
call
any questions, please go ahead or raise your hand. You can type in or raise your hand.
Take her outside, please.
And while you guys are typing in your questions, I will let everyone know that this webinar is being recorded, and the recording will be available on the Active Professional Development site, along with Kathy's info. The last slide will be included, so the info will be there.
Stop. Thanks, everybody. I appreciate you all being here.
Okay, we have a question.
Okay, ready.
What is different now in the tattoo shop, and what requirements are being made due to COVID?
Oh, wow. I'm not sure. Here in California, we haven't been given any kind of information on how we're supposed to be working because we're not open yet. But I believe that they're going to be asking for masks and hand washing and hand sanitizing and no hand holders. Where it'll just be the customer and the artist, I believe. I know that they've opened up in other areas of the country, but I really haven't seen much of what's going on. I'm just really guessing.
All right, and we have another question. Does your state require hepatitis B vaccines for artists?
Yes, absolutely. Or the declination form, which you can download right off my website, kathymonte.com, under downloads and resources. Yeah, and that's kept by the health regulator. And you also need to have one of those on file at your facility. I should have even spoke about that. It's a big fine if you don't have that when OSHA comes into the facility. Everyone in that facility should have at least a declination form, if not their shot records.
And see if anybody else is gonna ask any questions.
I guess one of the reasons I didn't even talk about the hepatitis B vaccine because it doesn't seem to be so prevalent anymore. We've really gotten a hold of anyone contracting hepatitis B from any kind of health care facility or body art because we've been so aware of it, and we've all been vaccinated, and now children are being vaccinated for hepatitis B. So you don't see it as much as we used 2 years ago.
All right, and we do have another question.
Okay.
Has ESIP been adopted by all states?
Well, it's a federal law. No, it has not been adopted by the health departments because it's an OSHA federal law, but we are regulated by OSHA and we should have an exposure control plan in place in all body art facilities. I think that's one of the things we're lacking in the industry. I'm doing an expert witness right now, and the shop that is being sued right now has an exposure control, or has a IPCP, an infection prevention control plan that's required by the state of California. I was very impressed with their paperwork that they had put together all by themselves as a small little business. It's a lot of work to do.
All right. More questions are, what about for hepatitis A and C?
Well, A is foodborne. It's not bloodborne. So that doesn't really pertain to us. That more pertains to the food industry. And hepatitis C, there's now a shot for hepatitis C, and there's from what I understand, there's a series of shots. They're very expensive, and they've had great results with them. People don't even have hepatitis C anymore, which is unheard of many years ago. So that can definitely help anyone who has hepatitis C. But there's not a vaccine for hepatitis C like there is hepatitis B.
Right. Next question is, in our community, most artists are independent contractors renting space in a studio. How does this impact the OSHA requirements?
Yeah, it still impacts it. If you're working inside a facility, the owner is responsible for your safety. So they have to provide you, whether you're independent contractor or just an employee, not just, but or an employee, yeah, you have to be able to protect your workers and provide personal protective equipment for them, and make sure that they have all the engineering controls like hand washing facilities and sharps containers at their procedure area. You know, usually artists have their own equipment, like their tubes and needles and inks and machines and things like that. But the owner needs to provide all the personal protective equipment: gloves, masks, sleeve guards, aprons, whatever's used.
All right. Next question is, what is the difference between state and federal OSHA?
Yeah, I'm noticing that more states are coming up with their own OSHA protocols. I know California seems to still be the most stringent one that we have. That's why we based our ESUP out of California State when we put it together. So that is definitely something that's coming around. But I think that you know, OSHA, our federal OSHA, how does that work? It's the federal is the standard, and then the state can make it more stringent, and then the county can make it more stringent than that, where the city can even make it more, add on to those laws too. So I'm sure that each state is based from federal. They've just added their own protocols that they think need to be there.
Okay. Next question is, under California's law, it is required to have an infection prevention and control plan. Is this the same as an ESIP?
Yes, it's just not as inclusive. Exposure control plan is more inclusive, where they want your safety data sheets and more written work practices, where the IPCP is pretty general, and that's inclusive in what we hand out as an ESUP. You know, you can make an IPCP 5 pages where exposure control and infection plan, boy, especially when you get involved in those safety data sheets or the mill specs, they can be thousands of pages.
Okay. Next question is, can a local health department require employees to get their hepatitis B vaccine series, or do they give them an option to opt out?
Yes, they give them the option to opt out with the declination form. It's called a declination hepatitis B form. And again, that's on my website, kathymonte.com, under downloads and resources. You can download that and fill it out and have it on your premise. And from what I understand, California State, the whole state is asking for a new artist to at least have a declination form, hepatitis B form filled out.
All right. Next question is, how great is the risk of transmission of HPV via aerosolized particles during a procedure?
It's not, it's bloodborne, right?
I don't know. Next question is, does an epi nurse in environmental health do a dual inspection, or is it just the health department?
Say that again. I'm sorry, I didn't get the first part.
Does an epi nurse or EPI nurse in environmental health do a dual inspection, or is it just the health department?
The health department regulates us. OSHA comes in on a complaint. A nurse, I'm not quite sure what kind of nurse that you're talking about, but I don't believe that they have anything to do with body art.
Okay. Next question is, would you speak to the exposure determination for health inspectors doing routine inspections?
I think that would be part of your inspection form when you go in. What are you looking for? You know, do they have a hand washing facility? Is it stocked with paper towels and soap? You know, having a class 5 integrator to monitor the sterilization machine, something like that, that would be part of your exposure determination. Making sure they have hot and cold running water for the hand washing facility, that I wish I had an inspection form in front of me. Sharps containers are safely, they don't have to be mounted, but safely placed in each procedure area within 1 step of the practitioner where they're working. And having their paperwork together. You know, do they have their informed consent and release forms? Are they documenting all of the sterile equipment that comes into the facility that they purchase from vendors? And is it documented with the date, the name of the company, the expiration date, the lot number, what it is? Is it needles or tubes or gauze or Q-tips, or what are you buying sterile? I think that would be if I had an inspection form here, that would help me with the answer to that question. But I think the health regulators inspection forms is determining an exposure. Laurel, you could help me with that question.
Yeah, so to piggyback off of that question, are the inspectors themselves at risk during an inspection?
Sure, absolutely. Anyone in the facility is. If it's not being cleaned and disinfected properly, absolutely. Boy, after this COVID-19, anybody's at risk. You know, that's why I suggest that when inspectors go in is to just be nice and introduce themselves and let the facility owner or practitioner know what they're up to, and don't touch anything, you know, ask for what you want. You know, you don't want to just go in there and start touching a bunch of things when you haven't even washed your hands or, you know, had any hand sanitizer or have gloves on, or, you know, you have to know what's going on in that facility. I think one of the sad things is there's so many regulators out there. Well, not a lot, but there's a few that have really never even been in a body art facility, but they already know how to inspect it. And it's such a unique industry that we have that it's really not like anything else that you've ever inspected before. So I think it's good to take a bloodborne pathogen class, or, you know, go into a tattoo shop and see what they're doing, not even as an inspector, just to, you know, see what's going on and talk to people and ask questions and, you know, have some kind of knowledge of it. I think that that's what makes my industry so upset with the regulatory agencies, is they feel like they're always doing the training when the inspectors come in. You know, don't touch my needles, you know, you can't open that drawer, those kinds of things. You know, it's just having a little bit of knowledge when you come in. We really appreciate that, so that we can talk with you and make whatever changes that are necessary. We're not, you know, about not changing. I always try to tell people that I do training for is to take a few tips or tricks that we've talked about and make those changes. You know, you're not going to be able to make a lot of changes at one time, but we only remember 10% of what we're told practically. But to go back and make some things that you think could help your facility.
All right. Next question is, some shops rent out their spaces to independent contractors. How does this affect the independent contractor who's responsible in these situations, or is the shop owner still responsible?
Shop owner still, bottom line, OSHA says the shop owner is responsible for providing a safe working environment. So, and they are also responsible for soliciting input from the workers to help make a more safe facility to work in. So I know that that is an issue that we have in the industry, but absolutely, you have to have a safe working environment, not only for the artist, but for the client and yourself and your families. Who knows what you're taking home?
And another question, going back to the hepatitis vaccine, or vaccines in general.
Hepatitis
do you
B.
know? Yeah. Do you know if everybody can just opt out, or if there are people that you have to get shot?
No, I don't think they can make you get a shot. No, you can sign the declination form. You have to either sign the declination form or you need your shot series. It's a series of 3 shots. So you get a shot today, then you get one a month from today, and then you get another one 5 months from the second shot, is how that works. And you need a completed hepatitis B vaccine record or the declination form. Yeah, anybody can opt out. And I'm pretty sure that a lot of the counties have their own declination forms on file. On their websites too, I've seen. Good questions.
We have a few more minutes if anybody has any other questions.
Yeah, and anybody, you can always feel free to email me or call me, text me. I'm always on the phone and answering questions and working to better our industry. We're working on videoing our bloodborne pathogen classes. I'm so excited. We're almost done. So we're going into the next generation of video instead of stagnant slides.
All right, here's another question. Do you know why California regulations are so different from other states?
Oh yeah, you know what? It's not even just California. It's every state, county, city has something different. And I swore when I started this 25 years ago with San Diego County in 1995 that I was going to bring the whole industry together. We are all going to work on the same page, and I don't think we're any closer to that than we were 25 years ago. You know, whenever you get a bunch of different people, you know, working together, everybody has their own little input that they like to put in, and it just really makes things different. And I don't know that that's ever going to happen, but I would love to see that myself. We're working hard with NEHA and AFTO to make a standard, though. With BACMA, the BAMC, the Body Art Model Code, we've all put together and worked really hard on it, and we're still trying to fine tune it and make it very understandable. But it seems like every time we go through it, we find little blips there that we want to change or fix or redo or.
All right, there is another question. Do the wipes or other products being used to clean off blood or bodily fluids have to be sterile?
The wipes, are you talking about the little wipes that come in the jug you pull out? Is that what you said? The wipes? Yeah. Sterile? No. I don't think they're sterile. They're a tuberculocidal disinfectant is what we need to use in the body art industry. I love Opticide, but there's also Maticide 1, Maticide FD, Cavicide, there's Tattooicide, there's a bunch of different sides that we can use in the body art industry. But it needs to have some kind of tuberculocidal EPA registered disinfectant.
Okay, there's some clarification on that question. They were talking about the ones for the skin. So I guess so for prepping for the procedure.
I don't think that they're sterilized, no. The one I like to work with is Sanoderm. It's just antibacterial for the skin, not sterile. We don't do a sterile procedure, but we use sterile equipment.
Any last questions? We still have a couple more minutes.
If you need to add to anything I'm saying, Laurel, please feel free.
I think you're doing a great job.
Oh, thank you. I'm trying, but I think maybe I could be missing something somewhere. I think I know my stuff. It's been a long road and I'm loving it.
We still have a few minutes, so if we want to open up the phone lines, Laurel informed me that Jody has her hand raised, so I will unmute her and she can ask her own question. Jody, go ahead and ask your question. You are unmuted. You might need to unmute yourself.
Hello, Jody.
Hey, can you guys hear me?
We can hear you.
Awesome. I just wanted to, Kathy, that was awesome. Thank you so much for sharing. I just, honestly, Kathy and I work together with Laurel on the AFTO body art committees, and I just wanted to offer my assistance and backup from an inspector perspective, if you like.
Yes, please.
So our shops are reopened. Our tattoo shops reopened May 1st. And the rules here, the new COVID rules, is you're not allowed to have more than 10 people in our facilities. So that means 5 artists and 5 clients, no extra people, just like Kathy said. Artists and customers are required to wear masks. As far as piercing goes, you can't do any procedures that require you to remove your mask. So nostril, lip, tongue, septum, anything like that. A lot of them are taking temperatures at the door. We aren't requiring that. That's something that they are doing on their own if they're wanting to. But that's about it for COVID. And Kathy, I think you did a great job explaining what we look for as far as inspections too. And I like your perspective, and I feel the same way. I think unfortunately there's not a ton of resources at this point to train regulators, and those of us that are real familiar with body art have gone kind of had sought out a lot of that on our own, but that's a lot of what we're working on through AFTO is trying to come up with some of those resources so that it's more widely available. Because I totally agree. Just because you're a great food safety inspector does not make you a great body art inspector. And the very first thing I tell new inspectors when I train them is to remember that you aren't the professional, your artist is. And when you walk into a facility, for, like you said, the first thing they should be doing anyways is washing their hands, no matter what type of facility they're walking into. That's what we are all trained as regulators. And don't touch things. Always be respectful, always be polite, and always ask, and never touch anything without gloves on if you're not sure.
Ask.
Yeah. Just ask, just always ask, because it is very different. You hit on all the main stuff. I think, like we check for, you did say something about, obviously if it's all disposable, we here, all I can speak for is Colorado, not anywhere else. And the rules vary greatly, not only from state to state, but sometimes county to county, which makes it challenging. Yeah, that is a problem between regular. Yeah. And I think that we check for mop sinks to make sure, like you said, hot and cold running water, to make sure there's a restroom available. In Colorado, required that they keep the paperwork. You have to keep employee records for 1 year, client records for 3 years. I believe sterilization logs for 5 years if you are not all disposable. So that's all I can think of that that you didn't say. I'm sure you could be an inspector yourself, Kathy, and do a great job.
Well, thanks. I'll leave that to you guys. Thanks, Jody.
Of course.
I'm going to interrupt you real quick, Jody. There's one more question for you, Kathy.
Okay.
Do you know if there's any tracking being done on artists?
Tracking?
Yeah, I'm assuming as far as
legally.
I would think like it's
New Hampshire.
New Hampshire does.
I'm sorry to say that, but we just did an exposure control plan for a very nice gentleman in New Hampshire and started reading some of their code there, and they are very into the legalities of the practitioner if they have any felonies or previous bits with the police. So I thought that was very interesting. But no, I don't.
All right.
I don't think so.
And one.
That would be more of a question for you and Jody, Laurel. You guys would know that better than I think.
I can't speak for all states by any means. I'm not sure. So another question going back to the wipes. So they were talking about not just wipes for skin prep, but for the procedure. So like if you're wiping blood off the skin during the procedure, do those need to be sterile?
No, I don't think that they're required to be sterile, no. I'm not quite sure if there's any area that would require a sterile wipe. I know that there's a lot of talk about sterile water. You know, a lot of there's a few regulators here in the California state that want to have sterile water involved in the mixing of inks when we're diluting inks. They would like to see that instead of using the distilled water that we use now. But I do know, and well, I guess I hear from the industry that it's very hard to get individual, like, you know, cups, like super small cups to mix, to dilute inks with. So that's a problem, because once you open up that container, it's not sterile anymore. So I'm not quite sure how that's going to work.
All right. And I know we're just past 2 o'clock, so it's very,
It's all good.
so for the, going back to the question about tracking on artists, they were referring to like tracking of complaints.
Oh, that would be MedWatch. Well, really, or your local health department should be keeping track of that too. So if there's some kind of an exposure or something, that should go to your local health department that regulates you, that you get your license from, or MedWatch with FDA. I think that's the only tracking facilities that we have right now. And please chime in if anybody knows of anything else.
All right. So we are at the top of the hour. Thank you, everybody, for joining the webinar and for all your questions. And if you have any questions, please feel free to reach out to Kathy. Her information is here.
Please.
And like Amy said, this will be posted on the AFTO website, on the AFTO Professional Development Series website. And thank you so much.
Thanks, everyone. Have a great day. Thanks, Laurel and Amy and Jody, too.
Thank you, Kathy.
Feel better, Casey.
Yep, feel better, Casey.